Good morning, everyone. I am Megan Rogers, Volunteer Supervisor of the Northwest Region of Indiana SHIP. And this is our first Medicare Monday of September. And I am joined by my co-hostess, Susan Spilly in Central Indiana. Good morning, Susan.
Good morning.
And we have some special guests with us this morning. This is one of our coffee and conversations with a SHIP site in Indiana. And we have asked one of my newer SHIP sites in northern Indiana, Elkhart County, to join us this morning to talk about the wonderful work that they do at their organization, Heart City. And I am joined with Amanda Schwartz and Moy Santos. Good morning, Amanda. Good morning, Moy.
Good morning. Thank you for having us.
Good morning. Good morning.
Thank you for hopping on this lovely, sunny, chilly Monday morning.
Very
I
chill.
hear we're in false fall. I think it's supposed to warm up again. But all right. So, Amanda, would you like to let us know what your title is and a little bit about what you do at Heart City?
Sure. Again, my name's Amanda. I'm the Medical Operations Manager for Heart City Health. I help for the 3 medical sites, and then we also have a 4th site for dental that we have a manager for.
Wonderful, wonderful. Moy, can you let us know what you do with Heart City?
Of course. Again, my name is Moises Santos. I work at our scenic location on Highvalley Avenue. I am the site coordinator, and I've been with Heart City for about 12 years now.
Oh, wow, that's wonderful. Wonderful. Amanda, how long have you been with Heart City? I may have missed that.
Moy beats me on that one by far. I've only been here 2 years, but
Oh,
I've
wow,
been
okay.
here for a long time.
Wonderful, wonderful. Well, could one of you kind of walk us through a little bit about what Heart City does besides SHIP counseling?
Sure. We're a federally qualified health center, so you'll hear us say FQHC a lot. We're based in Elkhart, Indiana, but we do see patients from all surrounding counties. We provide care for patients that's comprehensive, affordable, regardless of their ability to pay. We'll see any patient that comes in. We have primary care, dental, behavioral health. We have pharmacy services. But our mission is to treat the whole person with dignity and respect and making healthcare more accessible.
Wonderful. Susan, do you have any questions for Amanda or Moy? I'm going to turn it over to you for a second.
Yes. How many clinics do you have and where are they? And I've got to know where the scenic health clinic is. Is it somewhere scenic?
I wish it was scenic. We're hoping it builds up and becomes very scenic in the area. There's a lot of growth happening there. But it's off of Hively in Elkhart, Indiana. Hively and Scenic is the corner 2 roads. And then we have our main site is off Simpson Avenue in Elkhart. We have a dental practice that's just a block from us. And then women's health is over off Cassopolis in Elkhart.
So you're solidly in the city of Elkhart and in the county of Elkhart.
Correct.
But
Correct.
people from other counties can come to one of your clinics?
Yes. I'm not
Yes.
sure how many zip codes that we currently see. I was trying to get that data for today, but we see a lot of patients from neighboring counties as well.
Wonderful. Besides the medical and dental, what are some of the other services like around insurance that patients or clients might be able to utilize with Heart City?
Do you want to speak to that, Moy?
So aside from having medical, we do have a behavioral health department. And then within behavioral health, and it kind of divides a little bit and seeing a little bit of therapy as well. So it varies on when you want to be seen with behavioral health or something for a medication refill or just to speak with a therapist.
Wonderful. And besides the behavioral health, and I know, you're on here today because you guys do SHIP counseling,
Mhm.
and our audience primarily knows that is with Medicare, but do you guys help with any other insurances?
We do. We have Medicaid navigators at each site that can help anyone see if they qualify and enroll them with Medicaid. Um, we are really focusing on this fall. We have both Medicaid and Medicare enrollment happening, so any site can help with that.
Do your folks also help with the federal marketplace navigation and
Yes,
helping
yeah,
people get a marketplace policy?
correct.
Yes.
Okay.
Wonderful.
It sounds like a one-stop shop if you live in Elkhart for
Yes,
your
we're trying
mental
to,
health, dental health, and medical services.
Mhm.
Yeah,
yes,
FQHCs are wonderful things.
they are.
Yes.
It's been a blessing to work, with a federally qualified health center for myself. Um, just being able to take away the strain of how patients are gonna pay for it and be
Mhm.
able to just offer the care, that they deserve.
Right. So affording the care that's available there at Heart City, do you have a sliding scale based on their income? Is that how you do it?
Yes, we have a
If they don't
sliding.
have insurance, yeah.
Right, and
Okay.
we'll set up payment plans, whatever we can to help them out.
Mhm. So do your clinics provide the annual vaccinations for people, or does that go through your pharmacy?
Our clinics do, right on the floor, yeah.
Hmm.
Do you have your stash of COVID vaccines?
We do. We actually started a flu clinic as well today, for flu vaccine for this fall.
Great.
Come get your flu shot.
Already did.
Important. Me
Good job,
too.
Susan. Good job.
But the clinic I went to didn't have the COVID boosters in yet, so I'll have to
Mhm.
wait for that.
Yeah. Do you
Yeah.
guys have your COVID boosters in yet?
Yeah, I believe our pharmacist said that they got them in this last week.
Oh, good. Okay, yeah. Because my husband and I, we tried to get our COVID with our flu, and the pharmacy said, nope, not till middle of September or October. So maybe I'll call them.
Yeah, they
Yeah.
might have them in
Mhm.
now.
Wonderful. Well, Susan, can you think of another question? I'm trying to think of one as well.
Well, I would like to know where you see
Hmm.
um, how you see SHIP fitting into your service and what prompted you to, this is a three-part question. Isn't that terrible? And what prompted you to follow up? And at the first question would be, how did you ever hear about SHIP?
SHIP was already started when I came here. They had started the conversations on it. I do know that for the patients that are aging into Medicare, there's a lot of pieces to their care and really starting with just helping them figure it out. There's no right way or wrong way to do it, but some people don't know where to go to even learn about the policies from an unbiased person that's not trying to sell them a policy. So that's one thing we really liked about SHIP. We we already had the Medicaid navigators at each site. And they also help with our finance, so we can help people with payment plans. And so we thought, well, that will fit right in with their role by having them be SHIP counselors as well.
Right. So, Moy, I know you're new to the game, but what do you think, what is or what do you think is going to be your favorite part about being a SHIP counselor?
Well, I did do financial services prior my post that I currently have, so I understand a lot of um, what insurance covers and what insurance might not cover, and how to explain this to all of our patients here at the clinic, and not just anyone, everyone who wants to sign up for Medicaid, Medicare, or the marketplace. For me, it's about conveying the information of this is what insurance is all about. This is what you need to look for. This is what you need to think about. Quite a lot of things that most of the time they're not aware of, like in network, out of network. Will my doctor take this insurance and whatnot? So it's about explaining what all the insurance is about. And that's what I really enjoy and having those talks with the patients all the time.
Right. And, when we have other FQHCs who are partner organizations with SHIP, and what I also hear them say is with them being SHIP counselors, they don't have to stop helping people with insurance information once they become Medicare beneficiaries, that they will be able to truly serve them through the end of their lives when they don't need insurance anymore. And so it's not a start stop, it's a start and continue on.
That's right.
That's right.
We want to help them be confident in their choice and show that they can keep their primary care provider that they have here rather than having to go and search for another one, and educating them through that process.
Right. Also, I'll just give you a shout out and a thank you for being an additional partner with Indiana SHIP and being an enrollment center where Medicare beneficiaries can get help applying for some really helpful programs that can offset those costs of Medicare. So thank you for that.
Absolutely. We're excited for those enrollment days this fall.
Yeah, it's going to be great being able to offer those open enrollment days that we've scheduled right on site for your patients. They come in for an appointment, they can come in down and see us as well for their Medicare for 2026.
Right.
So it should be a great time, and you'll be able to see more hands-on what SHIP does, the education piece, because Maury, that's a big piece of what we do. So
Right.
it's a big piece and it's an important piece because it always amazes me what people don't know about insurance. They don't
Correct.
understand the terms, they don't understand how it works. And young, old, college master degrees or just high school degrees. Everyone can be confused about insurance. So it's great that Heart City has partnered with SHIP for this. And like Susan said, you're not stopping. You helping them with Medicaid, Marketplace, and now you can continue. So that's wonderful. We're excited about the partnership.
We are too.
We are too.
You're working
Wonderful.
with us.
Do you, at your clinics, do you have people who speak Spanish that are going to be SHIP counselors or that are SHIP counselors?
Right
Right.
here.
Okay, terrific.
And I think
Yes, we do. We do
several
have
of them.
several of our staff that are bilingual. So we should be able to, any of our Spanish speakers out there, if you're listening, we have the people. Los podemos ayudar.
Yeah. Also, just a shout out to a new venture between Indiana SHIP and Univision. They are airing commercials about SHIP and information. Right now, we're recruiting bilingual counselors, but soon we'll move into the sharing information about what's happening during open enrollment. So hopefully, we'll reach folks who speak Spanish and we'll be able to get you lots of business
I love that.
for
Sounds
your
good.
bilingual
Happy to
Spanish
help
English
everyone.
counselors. Yeah. Yeah. Well, we're thrilled to have that additional resource up there in Elkhart.
Mhm.
And we've had a SHIP counseling site for a long time in Elkhart, but it's a big city and there are plenty of people to help.
That's for sure.
Yes.
Come over to Heart City Health, any of our locations. We're happy to help.
Yeah. So tell me about that name, Heart City. It's Heart, like the heart.
Like the heart.
Yes. What's up with the name?
Hmm.
Does anybody know?
Well, I know it actually started. It wasn't actually, if I might be, don't quote me on this, but it might have been a different name when it all started. I believe it was actually Scenic that it was called. And then it changed to Heart City, I believe, when they started on Lasher Avenue. And then they transitioned to our Simpson location that they decided to go with Heart City. Something like that along the lines. I don't remember the whole details.
Hmm. It's a,
Doesn't heart has something to do like with
Um,
Elkhart itself, like
yes.
Elkhart mean something to do with heart because we've also got, well, it's a retail place, but there's Hart, Hart,
Hmm.
city
And
or health or something in Elkhart too. So doesn't it have something to do with Elkhart's meaning?
Yeah, I think the city, it kind of took on that logo or word with having
Hmm.
heart in Elkhart, even though it's not spelled as Heart. But I believe it started there. And more
Okay.
right, we started really small years ago and have just grown into these 4 sites in the city of Elkhart.
well, I think Heart City, spelled like Heart, is a very apt name for your organization because clearly you all have a heart for helping people.
Yes, we do.
Do either of you know or remember when Heart City was developed or opened or started? If not, that's fine. I know I promised no hard questions.
yeah, I'll have to get back to you on that one.
Okay,
I don't
no
remember all
problem.
my history.
I think it was, I think it was 1993,
Okay,
within a year or two.
okay, no, that's
Yeah.
fine. I was just curious.
And I think it, if I remember, it might have been like Moy was saying, Scenic Wellness Center or something like
Mhm.
that, but
Okay.
yeah.
Yeah, there might be a picture out there. You might be able to actually see the first location if you're one
Ooh.
of those people that like to do some research. We have it in our main location, I believe, somewhere. But like I said, I don't remember all the details on the history myself, even though I've been here for this long.
Oh, who has time for history? All right, well, I don't see any questions in the chat box. Susan, can you think of any other questions?
No, I just thank Amanda and Moy for joining us this morning and starting off your week with a little chat to our viewers on Facebook. And we appreciate what you do, your partnership with SHIP, and thank you. Thank you.
Thank you. Thank you for
Yes.
having us.
Thank you for having us.
Well, I have one more question before I turn it over to Susan to let us know what's coming up in the world of SHIP on Facebook. But if someone would like to become a patient at Heart City, how might they go about that?
They can walk into any of our 4 locations or give us a call for our main number, and we'll get the call directed to the right area and we'll get them scheduled.
Wonderful. Do either of you happen to remember that number?
Yes, 574-293-0052.
Wonderful. I'll get that put in the chat box as well.
And our website is heartcityhealth.org, and there'll be numbers to contact for each site as well.
Wonderful. All right. Well, Amanda and Moy, thank you so much, like Susan said, for coming on and educating us on Heart City and becoming a SHIP and enrollment center partner. We're very excited to be partnered together, and I know that you guys are going to do a fabulous job.
Thank you. We're
Thank
excited.
you.
Thank you so much.
Wonderful. Susan, I am going to put the calendar up here. Give me 1 second. If you can walk us through what's coming up next. But bear with me here. We need hold music. No, I'm trying to make it big, but here you go, Susan.
Okay. All right. So this was our first, like Megan said, our first Medicare Monday for September. And since it's the second week, we're going to zoom right in this week on Wednesday to talk about Advantage plans and Medigap plans. And we'll do a deeper dive on each of those options and make sure that people understand the differences so they can make good choices for themselves. That's this Wednesday in 2 days at 10 o'clock right here on our Facebook page. And then we're going to end the month with a really fun presentation about junk mail. Now, if you are even close to Medicare age or past it, this is the time of year when your mail carrier doesn't really like you because they're having to carry lots of stuff in their bags or in their trucks and stuff your mailboxes. And a lot of it is very confusing, and you don't know what to keep and what to toss. So, we're going to be talking about what to look for to authenticate your mail and what is safe just to toss or recycle. So join us for that at the last Monday of the month. That's on September 22nd to talk about your Medicare junk mail. Thank you very much for joining us today. Have a terrific week, and we will talk to you soon.